The Coronavirus and How It Has Impacted Older Adults Socially by Lily Casarza, Sydney Fina, and Julia Price. The coronavirus pandemic has now been a part of our lives for well over a year now, but what exactly is the science behind this new obstacle in our daily lives? The coronavirus, or also known more commonly as COVID-19, is an infectious respiratory disease that is caused by the SARS-CoV-2 virus. It is an RNA virus that has a complex structure which is responsible for its long length of survival in aerosols. Prior to 2019, the specific coronavirus had not been previously identified in humans, and there is evidence to suggest that it could be a mutation from a virus that originated in an animal. With each passing day, we are still learning more about this virus and how to combat it. All of the science behind this virus is important to understand so we can begin to comprehend how a virus beginning in China erupted into such a global pandemic. This virus spreads easily and primarily through droplets and virus particles that travel from an infected person to another individual. The most common means of transmission are through coughing, sneezing, and talking because COVID-19 is airborne. There are mutations in the structure of the proteins of the virus being discovered, which play a role in explaining the high infectivity rates as well as the increasing amount of new strains being studied. Once infected, the symptoms can manifest in multiple ways. Some individuals may be asymptomatic, some may lose their sense of taste or smell, like I did, some may experience symptoms similar to those of a common cold or flu, and some individuals may need hospital care due to the severity of their symptoms. The severity of the illness can depend on an individual's age as well as if they have any underlying medical conditions. If you think you may have been in close contact with an infected individual, it is important to seek out testing options due to what we know about the transmission rates of this virus. COVID-19 is diagnosed with one of two different laboratory tests. Both have the option of being a nasal test or a salivary test. The first kind of test is a PCR test, which focuses on virus genetic material. They work by extracting coronavirus RNA from the sample and converting it into DNA. Many copies of the viral DNA are then made so it is amplified enough to produce a measurable result that can determine whether an individual is positive or negative. The other type of test that is being done is an antigen test. These work similar to pregnancy tests in that they detect specific viral proteins and give a result based on whether the protein is present or not. If it's present, an individual is positive, and if it is not, the individual is negative. In the past 6 months, 3 vaccines to help stop the spread of the coronavirus have been introduced. Since the vaccine does not inject a live form of the virus, the 3 companies that produce vaccines use both mRNA vaccines and viral vector vaccines. Pfizer and Moderna vaccines are mRNA, which means they contain material from the virus that causes COVID-19 and give our cells instructions for how to make a harmless protein that is unique to the virus. Once our cells make copies of the protein, they destroy the genetic material from the vaccine. Our body then recognizes that the protein should not be there and prompts our cells to build both T and B lymphocytes that will remember how to fight the COVID-19 causing virus if we are infected with it in the future. On the other hand, Johnson & Johnson is a viral vector vaccine, which means it contains a modified version of a virus different from the one that causes COVID-19. Inside the shell of the modified virus, there is material for the COVID-19 causing virus. Once that material is within our cells, the genetic material gives cells instructions to make a protein that is unique to the virus that causes COVID-19. The rest of the process is similar to the mRNA vaccines, in which we create lymphocytes to build up our immunity for future infections.
The beginning, or the cause of the pandemic, is unknown and has become highly politicized. But what we do know for certain is that we first identified cases in Wuhan, China in December of 2019. We also know that most people who have COVID-19 have mild symptoms, but it can also cause severe health problems and even death. This explains why so many people are frightened in the beginning and even today. The effects on individuals are highly unknown. And we also know that on February 11th, 2020, the official name for this virus would be Coronavirus Disease 2019, abbreviated as COVID-19. And moving on to the timeline. I think that this timeline does a nice job of breaking down some of our major events that have happened in the past year as far as the virus has affected us. So moving from left to right, we can see that in January, and for some time before that, there was a mysterious new illness affecting parts of China. This would soon spread to all parts of the world in the following months, culminating in the world shutting down at the end of March and beginning of April. Borders were closed, schools were closed, everyone except for essential workers were told to stay home, and if they absolutely had to leave the house, social distancing practices were to be enforced. Eventually, the curve began to flatten, but many states were too eager to return to a normal life, so they lifted restrictions, and the number of cases began to rise again. Around July, there was a significant uptick in mental health issues, as people wonder if life will ever be the same again, as the United States was breaking records for daily cases and deaths. In December of 2020, the FDA authorized the use of 2 vaccines, just as 2 major variants of COVID-19 began to circulate. Today, things are better than they were 1 year ago, but we still have a long way to go. Cases and deaths are falling, but vaccine rollout is uneven, and there are still many people refusing to get vaccinated. So, what can we do to slow the spread? It's important to wear a mask that covers your mouth and your nose. Proper mask wearing seems to be the number one way to slow the spread. Practicing social distancing with people you don't live with is also another way. For right now, 6 feet is recommended, but we could see that shrinking down to 3 feet in the upcoming months. It's also recommended to avoid poorly ventilated spaces and wash hands with soap and water frequently. If soap and water are not available to you, hand sanitizer is the next best thing. And finally, when it becomes available to your age group, getting the COVID-19 vaccine will be the best way to protect yourself and others from contracting the virus.
As Julia mentioned, with the knowledge that the origins of the novel coronavirus were in Wuhan, China, some narratives became very accusatory and encouraged racist anti-Asian sentiments in the United States. This was perseverated by former President Donald Trump's declaration of the virus as the Kung flu and the China virus. Hate crimes flared up around the country against the Asian American population, and the community continues to face unwarranted backlash that is fueled by racism. Despite the World Health Organization's declaration of the COVID-19 outbreak as a pandemic, others believed that the virus was a hoax and that its severity was being inflated by the media. Many people, including some medical professionals, argued that COVID-19 was no more dangerous than influenza and that the general population was unnecessarily overreacting. Conspiracy theories regarding COVID developed and included ideas that China was using the coronavirus as a method of biological warfare or that 5G towers were causing the infection. Imhoff and Lamberty explain that people create conspiracy theories to compensate for the unknowns. Even though there has been significant research about the coronavirus and its magnitude, conspiracy theories allow people to feel more in control through pattern recognition and justification. False information was and continues to be rampant throughout the pandemic. For example, former President Donald Trump unironically suggested household cleaner Lysol as a treatment for the virus. This misinformation spreads quickly and may have damaging long-term effects. Since the beginning of the pandemic, the CDC began to release guidelines about the safest public practices. Such practices included self-quarantining, social distancing, business closures, and limitation of unnecessary travel. Additionally, masks became recognized as a required entity in public places, and mask mandates were adopted nationwide. These guidelines created a massive divide in the United States. Some people followed each guideline to a fine point and were completely restrictive in terms of limiting their public exposure. Others completely ignored these guidelines and continued to live their lives without making any changes. The American public fell and continues to fall on a wide spectrum in regards to the COVID-19 precautions that they take. Anti-maskers take the stance that public health mandates infringe on their civil liberties and affect their ability to live freely. Similarly, some people see these guidelines as a mechanism by which the government is trying to control the nation and its people. People that follow these guidelines justify their actions for many reasons, such as because of the work that public health employees have put in through the entirety of the pandemic, or because they know somebody that has been tragically affected by COVID-19. This divide continues to grow with the addition of COVID-19 vaccinations. Some people receive the vaccine the moment that they are eligible. Others question the effectiveness and safety of the vaccine because of its relatively quick origin. Conspiracy theories, such as that the vaccine contains a microchipping device or that the death rate is higher than the media portrays, contribute to the divide. All in all, the pandemic has social implications that will have long-standing effects as the country moves forward in this pandemic and beyond.
We interviewed 3 different individuals who have experience working with older adults. Andrea Casarza started working at a nursing home during the pandemic, while Sydney Fina volunteered at a nursing home before the pandemic started. These 2 perspectives allow us to compare and contrast how older adults have changed their lifestyles due to a global shutdown. Maya is currently a pharmacist, and she provided us with insight on what it is like working with older adults, including their fear and urge to return to normalcy. Both of the individuals who are currently working during the pandemic provided us with information on how the COVID-19 pandemic has social and political ties.
Hello, I'm here with Andrea Casarza, who started working at a nursing home during the COVID-19 pandemic. So, hi, Mrs. C, how are you?
Good. How are you, Sid?
Good. So, if you want to just talk a little bit about your experience when you started working, because obviously working at a nursing home during a pandemic is much different than the way it looked before the pandemic started. So, just tell me maybe like a day in the life of at the nursing home during the pandemic.
One of the things I kind of heard was without families in, nobody had anybody else other than staff to rely on, whether they needed something to drink, something to eat. There was really nobody else who was going to be able to kind of fill in some of these blanks. So you were kind of trying to, like I said, diffuse some behavior situations, but also just try to help where we could with any daily living type skills. Obviously, there were certified nurse assistants who were doing more of the hands-on things with that. but we also were doing the Zoom calls or FaceTime or Skype or whatever people were able to use. I worked primarily with dementia residents. So I think really we were trying to manage their loved ones on the outside more so than the ones on the inside because they didn't really understand as much. They weren't necessarily missing people as much because of their dementia. It was harder for them to understand what we were in the midst of.
Yeah, certainly. That makes so much sense that the social aspect of the pandemic probably hit the hardest. How did you find that, or if their physical health declined as a result of their mental health and emotional health being
I think
affected?
I I think a lot of the people, I think that things that were missing might have been, I think a lot of them had family that maybe came at mealtime and were able to do some of that encouragement. I mean, obviously, people who had a physical need to have assistance with feeding, that need was being met, but somebody who might have just needed some encouragement, or just, a suggestion, or if they were going to wander off to try to guide them. Our department also then started helping with mealtime on the dementia floor, just to be another set of hands to reroute people, redirect people, make sure that their trays found them or they found their trays. So I do think that that was something that just kind of their overall well being, whether they understood that it was directly related to their loved ones being there or not, I think that piece definitely showed itself as missing.
If you ever talked about the state of the pandemic or the global health crisis that we're in with the residents, did they have a certain reaction? Did they take any side of the issue, or was that something that wasn't really discussed within the?
I think on some of the other floors, because some of the people on other floors, maybe they had their television on. So you'd go into a room and Fox News would be blaring, and you'd go into another room and maybe MSNBC or CNN. And sometimes you would just cringe because it was like, I mean, there were other yucky things going on too that, you just didn't want that to be what they were ruminating on day after day and thinking about. But, who were we to take that away from them? And same thing with the newspaper. Some really liked to see the newspaper, and you kind of thought, oh, like, you need to take a minute and kind of talk about it. But there wasn't really a clear sense of, well, I don't know what would make someone feel better, in that sense. I think for some of them too, you were also trying to manage their concerns about the people on the outside, not just whether this news was going to concern them for their own selves, but is my son going to be okay? When you're telling them your loved ones can't come because we want to keep you safe and we want to keep them safe, even that was a fine line because you didn't want them to stay up at night worried that their daughter Jane was going to be sick tomorrow, or that. So that was kind of hard too, that you didn't know which was going to make them worry, scared for themselves. I think most of them were probably going to be more frightened for their loved ones on the outside.
In terms of residential activities and events that you held, obviously you wanted to keep them engaged and busy throughout this entire time so that they weren't just sitting in the room and eating meals alone. Was there a way to lead activities either virtually or in distance groups, or what would a typical activity look like?
Again, I think some of them looked a little bit different because I was on the dementia floor. It was definitely much more of a maybe a one-on-one type thing, unless it was balloon toss. That was one of the things that no matter what, if you fling a balloon at someone, there's a good chance they're going to hit it back or hit it, to appear. So basically, if the tables were 6 foot round tables, we knew that you could have 3 people at the table and kind of do balloon toss. I know that up on some of the other floors, they're doing um it's kind of like bingo, but there's no caller. Like, you have a sheet that tells you your letter and number, and you kind of fill it in. I mean, that's the saddest bingo ever, but that you could kind of collect them after and see who got bingo. It was a lot of crossword puzzles and word searches, and down on the dementia floor, we're doing a lot of just crafts. But definitely, the social component was not, it wasn't there like it had been before the pandemic. They were trying to limit anything that would cause people to congregate. Like, there used to be live music that would come in. So then the notion was, well, what if we played in the hall and then they were each just coming to their doorway? Just trying to find ways to bring people together, but not bring them together, but not have people feel so isolated. But sometimes you'd get a call from the nurses station on a floor and say, hey, like, if somebody's got time, so and so could really use a visit. And, maybe it's 10 minutes, maybe it's 5 minutes, maybe it was a walk outside when the weather was permitting, but just something so that they wouldn't feel quite so alone. You're trying to look at, even if they have two Zoom or FaceTime calls a week. Okay, so now you're talking two 20-minute blocks. It's really just, you're just trying to fill that time, but a day is a lot of hours. So it's a long time.
Well, thank you so much, Mrs. C, for talking about your experience working in the nursing home during this setting. And thank you for all of your work in general that you've done to improve the residents' quality of life, because we're also in need of that. And people that do that are incredible. So thank
Well,
you.
you're welcome. It was lovely to see you. Stay safe.
Thank you.
Bye.
Bye.
So I'm here with Sydney, who would spend her time volunteering at a local nursing home in her hometown before the pandemic started. And we wanted to gauge how the nursing home environment has changed due to the pandemic. So can you tell us, what did the social scene look like when you would volunteer at the nursing home? And what I mean by this is, did you get to physically interact with all the families? And were the activities more community-based, or were they individual-based like we're seeing now?
Hello. So I was a volunteer at my local nursing home from about 2014 to 2018. I was a regular volunteer, and the social scene there was much more active than you would see nowadays, obviously because of the pandemic. The main activity that I helped out with was bingo, and that was a favorite of the residents. It was Saturday afternoon, and first part of my volunteering started with me going around the hallways and getting residents that I knew wanted to go. That would often include me going into their rooms if they were dozing off in their chair, me coming up to them and gently tapping them on the shoulder, waking them up if they wanted to come and play, walking into all the public lounges, walking in the TV lounges and where the game room was to ask residents. So it means I had to get pretty close to them and touch their wheelchair, obviously, to bring them into the activity room where we held bingo. In terms of the activity itself, they shared bingo chips, they shared bingo cards. Nothing was sanitized to the level that things are sanitized now. Obviously, being a nursing home, it still have pretty rigid health and safety protocols, such as hand sanitization and cleaning up the tables after meals and after large activities, but not to the extent that we would see it now. And the tables were not super large. I would say they were maybe like 6 feet across by 4 feet. That's a really rough estimate. But 4+ residents would sit at each table. Sometimes we'd even put all the tables together and do like it looked like Thanksgiving dinner with all the residents there playing bingo together. It was such a fun time. And it was such a popular activity that sometimes there would be, 30 residents in the room playing bingo at like 5 tables. Like, it was very crowded, and family members would come bring their loved ones to bingo. They would sit around the table with them and play the game with them. We were all really close. So it really was dependent on me being in a close vicinity, and it was such a social event that something like bingo really would be very difficult to do during the pandemic, and I'm sure they still do it there because it's such a well-loved activity, but the way that it's done, perhaps it's over Zoom, perhaps there's one resident per table, and I'm sure it's very sought after who gets to take those tables, who has to wait for another round. Family members are going to be limited in terms of their visitation. It depends on the state and the county protocols. Luckily, in Central New York, nursing homes are slowly opening up their doors to folks that have been able to get vaccinated, but that depends, again, county and different facilities protocols. So the social scene at the nursing home before was very lively, and there were many activities that residents could gather at and volunteers could engage with, and activity leaders and nurses and whatnot could be present for. Unfortunately, it's incomparable to what's happening right now.
Sure. My name is Maya. I went to school all the way in Massachusetts, Springfield, Mass, Western New England University College of Pharmacy. Mm-hmm. That was my pharmacy school, but before that I went to Brockport and a whole bunch of local schools, and I'm a pharmacist.
Very nice.
Go ahead.
And then what about your patients? What about?
My patients are definitely baby boomers, so that is the majority of my patients. Mm-hmm. We have, a couple outliers, so it's kind of like a hodgepodge, but for the most part we serve like the elderly community.
Okay. And then as far as COVID has, to the whole world, so how has that affected any of your patients?
Like I said, for the most part, we do have the elderly. Mm-hmm. So they were a little bit more diligent about getting their prescriptions, Mm-hmm. They were scared that, the world might run out of their prescriptions. So they were very panicky, frantic about making sure they get early refills, making sure they do these things. Mm-hmm. And with COVID, it's kind of decreased the amount of contact we really have. So between everything we do now, there's always a shield between us. So before it used to be like, they'll come right next to me and show me, or take out, their hand and show me what's this, or show me their leg and ask what's this. Like, it was a lot more, I guess, intimate. Now it's just kind of through glass panes, even in like the drive-through setting, and even in person when they come in, and everybody's very hesitant, like they want to talk to you, but they also run away from you at the same time. So they're asking a question, but like staying far away. So it's taken, I guess, kind of maybe the heart out of it.
Okay.
So it'll take a while, I think, to kind of bring that back.
Yeah. You think it will go back to normal?
I think so. I think it'll take a little time, and I feel like the seniors that have gotten their vaccines are a little bit more looser. Like they're okay.
Good.
They want to like initiate again. They're back. They're back at it. So I'm okay with that. I don't truly mind.
So one of the early solutions offered by Donald Trump that has since been proven to be incorrect was the use of hydroxychloroquine to treat COVID-19. How did you feel about this at the time, and was there an increase in prescriptions, or are people asking about it more often?
It was a lot ridiculous, honestly. I mean, yes, he's the president, but he is by no means a Harvard scholar or someone who has worked in anything science related. I don't know if this was a political play, if this was a monetary play. Did he have stock invested in Plaquenil? Like, I truly don't know. It's just very ridiculous. But everyone got on this train. This was a big gravy train. Even some of the insurance policies were stopping it. They weren't allowing people to fill more than a certain amount of day supplies because it was depleting the whole supply for people that actually need it, that have lupus, that have the real conditions that there's no alternative for.
Right.
So you're depleting their supply for no reason, for medication that doesn't even work. But it was a very frantic. I mean, our president did suggest that we also drink bleach. So, I mean, there's a lot of things that I don't believe that came out of his mouth that actually did. So we're going to leave this to the scientists, and this is not one of the forms of treatment for COVID.
Good call.
Yes.
Very good call. Okay, so last question here. The class I'm taking focuses on aging and older adults. So as someone, as we've discussed, who frequently works with this population, are there any words of encouragement that you'd like to impart on them? May that be in relation to the pandemic, to those who may be hesitant to take medication because it shows their age, or anything else?
The elderly are actually pretty good when it comes to being mostly compliant and things like that. Yes, they're set in their own ways for certain things and certain medications, and if you attempt to suggest that, they haven't picked this up in like a month and they fight you, they're like, oh, but I have a whole bottle left. You kind of try to talk it out with them, see what happened. Did you maybe forget a dose? Was this like a long lost bottle? What bottle are you using? Like, what's the date on this bottle? Like, is this even accurate? So you kind of try to walk them through it, like how they really should be taking it, counsel them. But when it comes like to COVID vaccines and everything, they were right on it. When we started giving them, everybody wanted a shot, and it was mostly the elderly. They were very adamant. They are all about it. Every time when I speak to someone, counsel someone, they're like, I got it. They got the shot. I'm like, I'm very impressed. Like, this is the one section of the population I don't even have to fight on. They'll come and see me. They're like, do you have any extras? Like, can we get in? Can I get my family in? Can I get this in? So they were very dedicated to that. And I feel it's not easy being part of this boomer generation. Medicare has what we call a donut hole. So you spend a certain amount, and then you enter the hole again. So that's kind of like your deductible. You have to spend even more money to get out of it. So usually they hit that around the summer months, and then it's kind of a struggle to find what we can do for them. Sometimes they'll cut back to just a month, or, I mean, we're really great at the pharmacy. We always try to find them a coupon, some kind of way to save them some money, or transport costs or something. These are all these people that could be, our grandparents, our parents, things like that. So, I mean, we have the heart still in it. There are some barriers for us too, but at least we try.
Right, that's important. Just, treating the patient as a whole person. Kindness and compassion.
And like I said, I've been working for, at the store for so long, and I really know all of my patients. I know them by name. Like, I know what they're taking. I know what we talked about last time, so it's a lot easier to keep that relationship. And if they ever are in a pickle, they're a lot more comfortable to ask,
Right.
So we have a really good rapport with the elderly. And they'll come and, we'll get their blood pressure. We'll walk them through basic things, or sometimes they'll bring in their blood work and we'll kind of explain it before they see the doctor. And sometimes they'll have questions about interactions for me and things that they're not sure of, or over-the-counter products that they want to use, and do they really work? Is it a gimmick? It's a whole different generation, but at least they attempt to listen.
Right.
They're not the most patient generation, but we try. We try to kind of set them in their ways.
Yeah. Great. Well, thank you so much.
Well, thank you, Julia. I hope
For our steps forward, it is important to be aware that the virus is still around, and as our interviewees mentioned, it is still having detrimental impacts on the social lives of older adults in this country. As of right now, everyone should continue to do their part by wearing masks that cover the nose and mouth when in public, maintaining social distancing as appropriate, and getting the vaccine when it's your turn to do so.